So for example, CoolSculpting, well, a little bit of background on CoolSculpting is what is it? Basically, it's a machine. We have two. We were the first ones in town to have them, so we were the dual sculpting experts.
How long has that been out?
Whatever that means.
Or been available, I should say.
So probably available about, I want to say 10, 15 years at this point.
Wow.
So it's not it's a new-ish technology, but it's been around for a while. What's really interesting how it turned out was it was based on observation. The observation they had was in England. These kids would have popsicles, right? And they would put them in their mouths, and they would actually lose fat in the buccal mucosa, the cheek, right?
Okay. Wow.
And so basically, well, that's interesting. And then they also found that female equestrians, horse riders, especially in England where it's so darn cold, would go ahead and lose inner thigh fat because of the cold against their inner thighs. Okay. So taking that, they went ahead and took it to a couple of guys over at Harvard. Of course, it's Harvard, right? That were doing a lot of laser stuff. Sure. And so what they did was they kind of, because they have Santa's workshop there with all the lasers. It looks like Q's office. And so what they did was they figured out how to make this machine. And what the machine does is it's got a big old suction cup on it. Simplistically, it's got a suction cup on it. And then so you put it on the area you don't like, and then you press the button, and it sucks the fat into the suction cup. Okay, and then you press the second button, and it gets it really cold, 4 degrees centigrade. Right? Fat cells.
It's a bit of a funny feeling at first.
Oh yeah,
but once it sort of tingles and it gets numb, essentially.
Yeah. So you've been through it. So there's a little tug first, and then it gets cold because it's CoolSculpting, right? So basically kind of like, sticking...
Hence the name.
Right? So what a great name. Perfect. Yeah. So just like, you sprain your ankle, you stick it in a bucket of water and you get numb, same sort of thing. Okay. Yeah. So it used to be an hour. Now it's, 30-something minutes or whatever because we have the new adapters. Okay, great. Mm-hmm. But fat cells don't like that. And so fat cells, preferentially over other cells, will die off. And then we can usually get about a 25% reduction, which is not bad for sitting there watching Netflix,
right? Because you're not actually having surgery. It's non-invasive, which is great. I mean, and also too, what's interesting is there's a lot of different areas you can actually work on, more than just the obvious. I mean, one of the things was under the chin. Yep. Right. What are the areas that you typically work on?
Sure. It depends on the adapters, and now we have all the adapters, and so it's really, frankly, become my first line of defense for the upper arms, the bye-bye arms, where you keep waving and your arms keep waving bye-bye right afterwards. Sure. Because you go ahead and you not only do you get the fat, but in some cases, and it's a fat-killing machine, not a skin shrinkage machine. But in our experience, you get a little bit of skin shrinkage with that as well. So for under the arms and inner thighs, frankly, it's my first line of defense.